Welcome everyone to eHealth 2022 Virtual Conference and Trade Show. My name is Sheila Maloney. I'm Executive Vice President of Engagement and Marketing at Canada Health Infoway. And on behalf of Infoway, it's my sincere pleasure to welcome you to the eHealth Conference, our 22nd annual conference, and our third actually in the virtual realm. You know, when I think back and reflect on 22 years of eHealth, I think, wow, I would love to see a conference program from eHealth 2000. And I can't imagine it must have changed the progress that we've made and the significant advancement in this whole eHealth agenda in the last 20 years would have been, you know, remarkable. And actually, even the last 3 to 5 years, the amount of progress we've made in this as a community has been really different. Now, I suspect also that one of the things that hasn't changed, for me anyway, around eHealth is the actual community and the spirit that the eHealth conference engages us into. And so, you know, I always look forward to the eHealth conference. Once a year, you get together with your peers and your colleagues, you exchange ideas, you debate, you discuss, you share best practices. And that was always a highlight for me for the conference. We're a fairly small informatics community here in Canada. And so it's always great to see everybody. And that's the spirit that the eHealth conference has certainly developed over the 22 years. And I'm so thrilled to see it continue. One of the things that has changed over the last 22 years is that I think we finally recognize the expertise of patients and families and caregivers and the contribution that they can help make in contributing to this agenda. So I'm pleased to say for that reason that we are a patients included conference. And to get that designation, what that means is that patients, families, and caregivers were involved in every aspect of the program planning and execution. So we had patients participate on our program committee, on our abstract review committee, and they'll be presenting over the next couple of days. We have 2 patient partner meetups over the course of the conference, so I encourage you to attend those important conversations. And also we have a special shout out to the 12 patient scholarship recipients that will be joining us here at eHealth. So thank you for your contribution and welcome to eHealth. I hope by now you've all had a chance to review the conference program. A really rich program. In particular, I'm looking forward to our closing keynote, Dr. Brad Nader, the health humorist. So Dr. Nader sort of delivers healthcare comedy with an inspiring message. He'll talk about pharmaceutical ads and medical marijuana and healthcare lingo and a number of different topics like that. And I'm told he might even break into song. So not to be missed, the closing keynote. So once again, welcome to eHealth 2022 on behalf of Canada Health Infoway. And now I'll turn it over to my colleague, Steve O'Reilly at Keynote to provide his welcoming remarks.
Thanks, Sheila. Good morning, everyone. Bon matin tout le monde. My name is Steve O'Reilly. I work with the Canadian Institute for Health Information. I'm on point for our relationships with the federal government and the other pan-Canadian health organizations in Canada. Certainly happy to note how much more prevalent people are talking about health data these days in the era of COVID. It's become a frequent point of discussion with friends, family, even my butcher will ask me about COVID on occasion. So it's refreshing to see such a broader interest in health data at this time. Certainly during the pandemic, Keynote has been very busy working with the provinces, First Nations, Inuit, Métis communities, trying to identify COVID-related data needs, and certainly focused a lot on the unintended consequences of COVID on virtual care, mental health, and long-term care. Quite exciting work and quite consuming for our little organization. I would note we're putting a big emphasis on collaboration with our other pan-Canadian health organizations and other partners like Digital Health Canada. And just to highlight that, I'd encourage you to check out the host plenary session this year. That will include Brent Diverty, who's a VP at Keynote, along with Abby Calra, who is a Vice President with Infoway, along with Angela Liamos, a board member of Digital Health Canada. And they're going to discuss a project that we think is going to change the way you might think about health data in this country. So here we are again virtually, gathered using the Hubelo virtual event platform, which thankfully, gratefully has been sponsored this year by Meditech. This platform offers you many ways to engage with fellow attendees, watch multiple sessions, visit the trade show booths, and meet up with colleagues for a virtual cup of coffee. I'd encourage you to spend some time in the networking lounge Start your morning with a coffee chat, maybe with an old friend, possibly plan to join some of the hosted network sessions each day. Being virtual again this year means that eHealth 2022 is accessible to a lot of attendees who normally wouldn't be able to travel for in-person conferences. And I'd also like to recognize and welcome the almost 30% of attendees who are attending eHealth for the first time, which is a real demonstration of how this conference, eHealth and digital health, is really expanding across health and healthcare delivery. I'd also like to acknowledge we have 47 sponsors and exhibitors this year, which is a fantastic show of support from our industry. And again, a demonstration of the value that eHealth provides in keeping our community connected. So please sure to reach out to the sponsors and participate in the many interesting symposia and networking events. Thank you again for joining. And it's now my pleasure to pass the mic to Mark Castle.
Well, thank you, Steve. Good morning, Sheila. Good morning, everyone. My name is Mark Castleman, CEO at Digital Health Canada. And on behalf of the association, it's my great pleasure to welcome you and thank you for joining us at eHealth 2022. As has been mentioned, this trade show and conference, eHealth, has always been about bringing community together. It's our chance to collaborate, come together, and celebrate all the achievements in digital health over the past year. As we know, these last 2 years have been unprecedented. I hope this conference provides you with a venue to realize and celebrate all of those collective achievements that have supported our Canadian healthcare system. And also to take a bit of time for yourself to reconnect, connect with old colleagues, enjoy the sharing, the learning, and the overall conference environment. As a national community of digital health professionals, now is our time. The work you are doing is critical to the evolution of health service delivery in Canada, and many of these lessons can be shared with colleagues around the world, as Canada is leading the way forward in many areas of digital transformation and digital health. I'm looking forward personally to meeting with many of you, leaders in industry and professionals who are focused on key opportunities in digital health over the next couple of days using our platform. Key topics include acceleration of data sharing and digital transformation, data-driven decision-making, virtual care and health services, shifting the focus to in-home and community, addressing healthcare human resource challenges and automation solutions in healthcare to extend and support the work of care providers and providing information assets to patients and citizens. Connected integrated care delivery, cybersecurity, data integration, a broadening focus on mental health and digital mental health solutions, and critically, digital literacy and equity and the impact of the digital divide on vulnerable populations. eHealth Conference is all about community. At Digital Health Canada, it is our mission to connect, inspire, and empower you, the digital health professionals who are building the future of health. Today at eHealth and every day, we're with you and support you and the organizations you serve on your journey to excellence. Take a look around this platform. It's an amazing resource for you, sponsored by Meditech. Our eHealth team has been hard at work to launch a real virtual event experience. You'll see the leaderboard at the top of your screen where you can collect points as you move about the day in the next 2 days and around the platform. Let's just say you're going to want to collect as many points as you can. Another way to be involved is to add your voice to the discussions happening in the event feed in real time. Join a topic that's already started or post something you'd like others to weigh in on and start talking about. I can see a lot of polls happening, conference and communications. It's time to get this conference going. I'd like to introduce you to our MC over the next 2 days. So please join me in welcoming Cassie Fraser, Senior Director for Private Sector Engagement at Canada Health Infoway and a Board Director at Digital Health Canada. Cassie, welcome. The virtual stage is now yours.
That's great. Thank you, Mark. And hello to all of our attendees. Welcome to eHealth 2022. As Mark mentioned, I've been involved with the eHealth Conference and Trade Show for many years as both an attendee and a member of the Logistics and Host Committee. I've also been a Digital Health Canada board member for the past 2 years, and I'm really excited to join again this year as your MC throughout the main conference programming. We begin today first by acknowledging that the lands on which we're hosting this event include the traditional territories of many nations. Acknowledging the land is an Indigenous practice that's been happening for thousands of years. It recognizes and respects the legal and spiritual relationship Indigenous peoples have with their territories. We recognize that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and well-being. And we respect that Indigenous people have rich cultural and traditional practices that have been known to improve health outcomes. We invite all attendees to reflect on the territories from where you live as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. We respect the continued connections with our past, our present, and our future in our ongoing relationships with Indigenous and other peoples within our communities. So I know that we're all juggling competing priorities, and I'd like to thank you for taking the time to be here virtually. It really is so important that we make this time to come together and connect as an eHealth community. It's going to be a fantastic 2 days of innovation, inspiration, learning, and networking. So let's get started. Today, we are kicking off eHealth 2022 with our opening keynote called Innovation in Healthcare, a Global Perspective. Please join me in welcoming from Amazon Web Services and sponsor of this keynote, Elizabeth Keller. Welcome, Elizabeth.
Thank you so much, Cassie. And so nice to see everybody, Sheila and Mark and Steve. And it's been really exciting to be here. And hello, Canada. Really excited to be kicking off the 2022 conference for eHealth. My name is Elizabeth Keller, and I'm responsible for national business development for public sector healthcare here in Canada at Amazon Web Services. And as a former Digital Health Canada board member for 6 years, and now as an advisor to the Chief Forum, it brings me great pleasure in my new role at AWS to introduce Dr. Rowland Illing, who's our Chief Medical Officer, our Director of International Public Sector Healthcare, but also a clinician who understands the importance of improving patient outcomes. This last 2 years has brought unprecedented change to our healthcare world, and having seen both sides of the fence coming from public sector from the last 10 years, and now representing a leading cloud service provider, we actually can see that the pandemic created an opportunity to meet in the middle for private sector and public sector, to be creative and to pivot quickly, to solve real problems together. And you're going to hear about these types of customer stories today that highlight the success in Canada and abroad. So with that, I'd like to introduce Dr. Rowland Illing. Take it away, Rowland.
Thank you very much, Elizabeth. Thank you so much for the invitation to join you today. It's an absolute pleasure to be here. An incredible privilege to kick off the meeting. I love the fact that this is a patients included meeting. I think it's something that many other conferences can learn from. Whether we like it or not, we're living through a period of massive disruption, be it health, energy, climate, supply chains, social disparity. Digital disruption has been taking place all around us in all aspects of life, but for those of us in healthcare, progress on the ground has always seemed rather slow up until 2 years ago. I think we can all agree that the pandemic has served to turbocharge this move from digital for a number of reasons that I'll go into shortly. I believe this is a trend that will be maintained, certainly as we enter this period of new normal. Now, the cloud is very much part of our lives already. We use it every day, even if we don't necessarily notice it. If you're a big Star Wars fan, like me, and you've streamed The Mandalorian on Disney+, then you're using the cloud. It's the cloud that allows Disney Plus to stream more than 130 million subscribers globally and process multiple billions of events and terabytes of data within the platform in real time without going down. By the way, if you haven't started watching Obi-Wan Kenobi yet, it's really good and I thoroughly recommend it. And did you know that in 2021, 2 billion Tim Hortons coffees were sold? In fact, 8 out of 10 coffees sold in Canada were from Tim Hortons. Now, clearly, I'm not a Canadian, but it sounds like you Canadians really love your Timmies. With such a high demand, Tim Hortons leverages cloud to keep pace with ever-growing data demand that allows them to monitor customer sentiment and make proactive business decisions and make your experience better. And if you're a gamer or have gamers in the family like I do, then you certainly have heard of Fortnite. Fortnite's one of the world's most popular video games, with over 350 million players, and it runs almost entirely on the cloud. In December 2020, Fortnite peaked at upwards of 15 million concurrent players around the world, which could only happen with the computing capacity to scale and meet the constant and high fluctuations in player demand. And can I just say, my sons will be so impressed that I talked about Fortnite at a conference today. And we wouldn't be in Canada without talking about hockey. Recently, the NHL unveiled a new face-off probability statistic. It's a live in-game stat that will be displayed as a graphic and instantly shows the odds of a player winning a face-off and possession of the puck, and then displays that on the screen for fans watching the broadcast of the game. Before the puck is dropped in the face-off, the face-off probability machine learning engine identifies where on the ice the face-off is going to occur and who will take it, and then determines the probability of each player winning the draw. It's really cool, and it's something you can watch during the next playoff game. When I was discussing this with a friend before the presentation, I was advised to say, go Oilers at this point, but you'll have to let me know whether this is actually appropriate at the end. We engage with brands that we know every day. You know, we love them, we use them, whether you're watching a favorite show, booking travel plans, having a conference call, hailing a ride, live streaming, such as this event itself, making breakfast or editing a video. The cloud is part of our everyday. And consumption of the cloud in public sector is no different. There are thousands of governments, education institutions, non-profits, healthcare organizations using AWS globally. And we understand the needs of Canada's public sector for security, reliability, and cost savings. So who are we and where do we sit within Amazon? So Amazon is the cloud computing arm of Amazon itself, with the world's most comprehensive and broadly adopted cloud platform, offering over 200 fully featured services from data centers around the world. We have millions of customers, including the fastest growing startups, largest enterprises, and leading government agencies. We're a platform for builders to build the next generation of solutions to help end customers. And it's powered by this AWS global cloud infrastructure, which is the most secure, extensive, and reliable cloud platform available. Whether you need to deploy your application workloads across the globe in a single click, or you want to build and deploy specific applications closer to your end users with single-digit millisecond latency, AWS provides you with the cloud infrastructure where and when you need it. We now span across 84 availability zones with 26 geographic locations around the world. And you'll be happy to hear that we have our own local Canadian region consisting of 3 availability zones, each made up with 1 or more discrete data centers located around Montreal. AWS is also launching a second region in Calgary in late 2023 or early 2024, which will reduce latency for end users in Western Canada and support the development of advanced distributed solutions that span multiple AWS regions. And it will also provide additional flexibility for customers who want to store data and process data within Canada's borders. This new region is part of a planned investment of 4.3 billion Canadian dollars over the next 15 years, including data center construction, ongoing utilities and facilities costs, purchases of goods and services from regional businesses. Our economic impact study estimates that spending on infrastructure and construction over the next 15 years will increase Canada's GDP by about 4.9 billion Canadian dollars, along with direct and indirect economic benefits, and including nearly 1,000 new full-time equivalent jobs in Canada. Now, I've already talked about cloud in general, but there are some other points that I'd like to cover with you today, specifically relating to healthcare. And what I'll do is I'll give you those takeaway points up front. I'll talk a little bit about why healthcare in the cloud and some of Canada's amazing responses that you've done in response to COVID by leveraging cloud tools. I'll also tie these to some of the healthcare trends that we're seeing globally and what healthcare customers are asking us with help. So, spoiler alert, I'm going to give you my takeaway points up front. And the purpose of this is to really I mean, as we go on through the presentation, you can think about these takeaway points and how each of the examples that are provided really relate. So first of all, cloud enables security, scalability, value, and democratization. And what I mean by that is democratization not only to access and to data and computing power to build solutions, it's also democratization of delivery of those solutions to scientists, care providers, and patients. I'd also like to point out that industry challenges are already being met by leveraging cloud. You'll see examples coming up. And finally, I'll ask you, what problems do you see that can be addressed in your daily work by leveraging some of the solutions that you see here today? So, why healthcare in the cloud? I think the top thing they're asked about by customers is security, and it's architected to be the most flexible and secure cloud environment achievable today. Our core infrastructure satisfies the security of military, global banks, and other highly sensitive organizations. And it's the only cloud, commercial cloud that has the same standards in hardware and software across all the regions around the world, vetted as secure by third-party auditors, secure enough to run top secret workloads. It also has the deepest set of cloud security tools, over 200 services and features that tech companies and governments can leverage to make sure their data is secure. There is a shared responsibility model. Those groups and organizations leveraging cloud need to put in those access controls as they would do for their normal physical infrastructure. But we also bring scale. So we have significantly more investment into policing and countermeasures than is possible in most organizations. And we adhere to a plethora of internationally recognized standards. As a physician, the thing I want to know is when I use a digital system is that it comes on, and its availability is absolutely critical. And we're seeing a real pivot point in the delivery of digital services where we can run production environments in the cloud. So we say we have an availability of 5 nines. That means that our systems are available for 99.999% of the time. That means there's an average of less than 6 minutes downtime per year. And we have incredible durability. So meaning that if appropriately architected, data on the system will not be lost. So we have something called 11 nines of durability. That's 99 point and then 7 nines after that. Which means if you're storing 1 billion objects, you'd go 100 years without losing anything. The next point is agility, and that's allowing customers to spin up resources they need, deploying hundreds or even thousands of computers in minutes. And so it means that customers can very quickly deploy very large amounts of compute to solve questions. And I'll provide examples of this, certainly around virtual care, such as East San Giovanni later in the conversation. Cost savings have become more and more critical. And if you look at how people are moving to cloud, often that is something which is a key factor. For instance, just by moving to cloud, the Canadian Institute of Health Information, CIHI, which I'll talk about again later, were able to reduce their cost of ownership by 10%, and that was before they modernized their applications. And also Tufts Health in the US are anticipating cost savings of 28% by moving their electronic healthcare records to the cloud. Elasticity is a feature of the cloud that allows not only to scale up quickly, but also scale back down quickly. And so if you require a lot of computing power in short bursts, you only have to pay for what you use. And so this is a really good environment for test and development. So startups like to use this to spin things up, test and see how they work, and then spin things back down again. An example of this will be Moderna and the work they did during vaccine development, which again, I'll come to. Fast innovation is key. And by repurposing your health IT resources away from just managing infrastructure to innovating, it's a really interesting pivot for that e-health workforce of the future. And again, there's a lot of work going on around training education to make sure that we've got a fit-for-purpose workforce that really knows how to leverage the tools in the cloud most effectively. And these last two things, democratization of access to data and computing and IoT, I'll mention specifically at the end and as we go through the rest of the presentation. So first of all, what was Canada's COVID-19 response with regards to digital health? I'll start by looking at a few examples of how Canadian agencies and organizations met citizens' needs quickly, building secure and compliant solutions to deliver critical information and services with a digital-first experience. This is by no means everything. This is a mere snapshot of what you achieved over the last 2 years. So to disseminate important COVID-19 related information, the Canadian Digital Service, which is an in-house delivery unit of the Government of Canada, turned to AWS to scale its Notify system, which was optimized to reach hundreds of thousands of Canadians. And now Notify can send up to 10 million messages per day, with the ability to scale further if needed. CDS would later develop and launch the COVID Alert app, which is an application which would notify users of possible exposures before symptoms appear in a way that won't jeopardize privacy. With the launch of the Emergency Response Benefit Program, the Government of Canada responded by working with AWS and its partner Accenture to launch a cloud-based call center. Using Amazon Connect, a service that helps scale call centers, it created a 1,500 person call center in Canada that could seamlessly expand as necessary, eventually handling an average of 27,000 calls per day, with some days exceeding 40,000 calls. And those calls help Canadians apply for tens of billions of dollars of Canadian government funding that was made available to residents, which was a critical lifeline for them during the emergency. And to keep citizens safe, the Canada Border Services Agency and Public Health Agency of Canada launched the ArriveCan app in April 2020. And the app allows travelers entering the country by air, land or sea to report their contact tracing and quarantine information within 48 hours prior to entry into Canada. And the app helps reduce wait times and minimizes contact with border security and public health agencies. And I know for those of you who have managed to travel outside Canada, you're most certainly familiar with this app already. Now, as these services were being launched, COVID-19 research was taking place at the University of British Columbia and many other institutions. But I'm calling out the University of British Columbia because of its Innovation Centre, or KIC, the Cloud Innovation Centre, which would lead to the inception of a series of open source projects, all powered by AWS. Now, to double down on that Cloud Innovation Centre, the KIC serves as a hub for public sector community projects and challenges. And they're a place where you can engage with subject matter experts to identify solutions and build proofs of concept. And the best part is that the proofs of concept and all the outputs will be published as open source for other community members to access and use, not only in Canada, but around the world. The University of British Columbia has the Community Health and Wellbeing KIC, specifically geared up to do that, and pivoted very quickly in response to the global pandemic to support the challenges presented by COVID-19. I'd like to call out three of the things they did. The first was to develop an AI model for COVID-19 CT diagnostics and prognosis. And so this was in collaboration with the radiologists from Vancouver General Hospital. And this AI provided metrics about infection that couldn't be assessed by the human eye, but gave probability of infection and volume of lung disease involved. The Vancouver Coastal Health MRI project, Can't Wait, set out to create a solution that would improve MRI requesting processes across the region. And these led to reduced patient waiting times and optimized prioritization for radiologists at a time when the amount of demand on the system was almost overwhelming. They're running at well over 100% capacity. Finally, the Seratus project, which is in the middle here, is an open science project for the ultra-rapid discovery of known and unknown coronaviruses in response to the COVID-19 pandemic by screening all the public RNA sequencing data globally. I just wanted to show you this map. So researchers in the Seratus project found 132,000 new RNA viruses, where just 15,000 were known previously, and 9 new species of coronavirus. Dr. Artem Bababian, who's behind the Seratus project, estimates that without the KIC and without the cloud, it would take traditional supercomputers well over a year and hundreds of thousands of dollars to perform the 2,000 years of CPU time necessary for this analysis. Seratus accomplished it in 11 days for $24,000. It's absolutely incredible. And this map shows where all of that open virome data came from around the world. I wanted to show it to you because it's very pretty. In fact, Dr. Artem Bababian, who is behind the project, will be presenting on the project in person at the AWS Toronto Summit on June the 22nd. And if you're in the Greater Toronto area, I'd highly recommend you go and see him speak in person. There we go. So we've seen that Canadian organisations are innovating like never before during the pandemic. And I'd like to call out a couple of the organisations in turn. So CIHI, or Canadian Institute for Health Information, supports Canada's health system, as you know, and touches the lives of Canadians by collecting and analysing healthcare data nationwide. They migrated 90% of their workloads to the AWS cloud over the last 2 years. And it improved their agility, performance, and scaling capability to process massive amounts of data. And the migration took only half the time CIHI planned, and also they did it remotely, which is incredible. As I said at the beginning, they're also able to reduce their total cost of ownership by 10% and be able to instantly scale up at need. As mentioned by Ron Huckster, who's the CIO of CIHI, being in the cloud has given CIHI the functionality to respond to business needs at a rate that no one saw coming. It wouldn't have been possible on our previous on-premises infrastructure. And we've also seen tremendous innovation at the provincial level. So on the West Coast, the Provincial Health Service Authority and the British Columbia Ministry of Health leveraged Amazon Pinpoint, which was a scalable inbound and outbound communication service to share COVID-19 test results with its citizens. The service is implemented based on the need to lower costs and improve data residency and be compliant with federal and provincial privacy legislation. So shortly after, they built the IMS BC platform with Salesforce and Deloitte as partners in less than 2 months. And to date, roughly 50 million SMS vaccination-related messages have been sent for scheduling and booking. Confirmation, pre and post immunization education is all included. And the implementation improved their data residency and lowered costs by around 30%. In Ontario, the Ministry of Health will soon be the first public sector customer in Canada to leverage Amazon managed services to manage and operate their infrastructure more effectively and securely. With this, they partnered to build their provincial case and contact management and COVAXON management system to support COVID-19 pandemic response across Ontario. And there's now solid readiness with AWS and their partners Salesforce and Accenture should further pandemics arise, and also to be leveraged for vaccines more broadly. Back in Ontario, we have the Central East Hospital Cluster. So leveraging AWS and Deloitte for their disaster recovery, 7 organizations came together. So Campbellfield Memorial Hospital, Halliburton Highlands Health Services, Lakeridge Health, Northumberland Hills Hospital, Peterborough Regional Health Services, Ross Memorial Hospital, and Scarborough Health Network. They all came together and took great strides to improve patient care in Ontario at a moment where health was top of mind. So what they've done is created a shared clinical information system using the EPIC, electronic healthcare record. And by moving their backup to the cloud, their regional team estimates there'll be a $10 million saving over 10 years due to eliminating the expense of setting up a secondary data center for backup. There are many other examples. Can Immunize in Ottawa, setting up a smartphone app for Ontarians to track their family's vaccination. They reduced their time to immunization by 50%. Because everything was digital, it minimized the time for each patient had to spend in the vaccination clinic. And this really as a pilot, led them to scale across Nova Scotia's province. and over 1 million people now being vaccinated and being recorded on this system. As I'll mention later in the general trends we're seeing globally, virtual care and health equity have become major topics for healthcare organizations around the world. And with regards to health equity, access has historically been tough for Indigenous peoples, and the pandemic has exacerbated this issue. Two very brief call-outs to WellTel, a British Columbia-based digital health company that supports marginalised Indigenous communities in Canada, and also now New Zealand, who may not have internet access to engage with healthcare providers. So what they do is creating SMS messaging chatbot services and engagement platforms that allow users to engage the range of care services, including mental health support. Lumica is a virtual care platform and allowed 37,000 patients to access care from a dozen providers over a span of 20 months. In early 2022, it was selected to be the software of choice for the entire province of Saskatchewan via an RFP. And in this new contract, they're going to supply virtual care to from 3,500 providers covering 1.2 million Saskatchewan residents. And we'll focus more on virtual care and health equity later on in the presentation. So across Canada, we've seen a whole range of digital health services spin up, and we've also seen some very interesting partnerships with Amazon Alexa. So Amazon Alexa is Amazon's cloud-based voice service, which can pair with voices like Amazon Echo and Amazon Dot, and expanding to help care services and care delivery. And we've seen this used in 3 specific institutions in Canada. So the UHN team launched an Alexa version of their Medley application to measure blood pressure, weight, and symptoms daily by creating a visual aspect in the Amazon Echo Show to drive engagement with patients. And they showed through a pilot that for certain patients, voice-based technology was more user-friendly than just using a phone app. Baycrest had to restrict their visitors to their campus during COVID, and they found that isolation was proving really difficult for their residents' mental health. And so to support their patients, they leveraged Amazon Alexa to create a remote visiting service and private rooms. And this improved social engagement, education, and training. And finally, McGill University noticed that a lot of human resources were being used to screen for symptoms of COVID, and they ran a pilot in their cardiology clinic, but effectively looked at how interaction with Alexa could screen patients and their families for symptoms of COVID prior to arriving and interacting with clinical staff. Clearly, there are a lot more applications out there for Alexa services waiting to be tapped into. And as I said, these are just a few of the examples of customers driving innovation across Canada. And as AWS, we work with all levels of customer. We talk to national governments, provincial governments and health authorities, hospitals, research organizations and diagnostic networks, primary social ambulatory care organizations, as well as payers, and of course, health techs who are building on AWS to reinvent how we can collaborate with patients, make data-driven clinical decisions, and enable precision medicine. And we've got a great number of partners who are doing this. And again, just a few call outs to the likes of Salesforce. So Jordan, Brian, and Asan, if you're watching, Iron Mountain, who did some great work with Grey Bruce to digitize 32,000 patient charts and 3.5 million patient images. And again, special thanks for Kristen Wilcox there. And from Accenture, Jimmy Yang and Karina Guy, and of course, Deloitte. And I'd like to call out Mary Sanigan. Of course, there are so many other amazing people and partners we work with, I can't mention them all, but we've got a great partnership to support public sector across Canada, creating easy and agile solutions to really deliver for citizens and patients. Now, how does this tie into the broader picture that we're seeing across the world? Well, what we're seeing is what's unfolding in Canada is true everywhere else. And even before the massive shock that COVID gave to the system, there are some underlying longer-term trends that deserve to highlight. So We're all facing an aging population, an unmet capacity need in our staffing. And certainly that's only been exacerbated by the massive need for extra staff during the pandemic and burnout. There's a massive increase in the volume of data and a desire to improve efficiency. As I said, sophisticated security breaches and the need for security. When we look about what our healthcare customers are focused on, what they're investing in is absolutely critical. And what we see is a specific focus on global market size of these WHO subsystem categories or solution areas. So genomics, health records, imaging, population health, and virtual care are high up there in the things that our customers are looking for to deliver. And of all of those, genomics and healthcare records seem to be the biggest focus. So when we ask, what is the AWS healthcare mission? How do we support all of these challenges we're facing, and how do we support these solution areas, these subsystems categories? What do we do? Well, we enable access and delivery of person-centered healthcare, driving improved outcomes at a lower cost by accelerating the digitization and utilization of healthcare and life sciences data. And we really want to deliver this mission to our customers, leveraging the best of health techs to provide those solutions. And it'll be interesting for you to consider from those examples I gave from Canada, where they fall into these 4 broad groupings that we see around the world. So the focus on mission workloads, national strategies, innovation, education, and startups, and seamless care delivery to our customers. So focusing on mission workloads, we launched AWS for Health last year that really allows end customers to find specific solutions in those categories at the point of need. So electronic healthcare records, imaging, and genomics. So to look for a moment at those electronic healthcare records, as I've said, there is a tremendous move to move production environments of these systems into the cloud. So Dataluz is actually the largest electronic medical record provider in the world by install base. You may not have heard of them, but they actually supply electronic healthcare records to 6,500 hospitals globally. And they're very prevalent in the UK and in Europe. And in the UK, they've already migrated 6 customers onto AWS for their production environments, with another 14 planned for the immediate future. And these are full production, not just disaster recovery and backup. We see our first full production environment of Epic go live in Tufts, that was Wellforce, only last month. And not only have they moved their electronic healthcare record, they've moved 42 co-traveler applications, which is being used by 2,500 physicians supporting 4 million patients. And as I said at the start, they're estimating a saving of 28% across the board. And indeed, Geisinger Health has just announced an Epic migration also into the cloud with 400 applications included. Medical imaging is obviously close to my heart, but we see partners able to deploy imaging apps to end customers in real time, ensuring the latest version of the software is always available to the radiologists and is updated without the need for on-site engineering. Both Philips and GE are re-platforming their imaging solutions onto AWS. And Visage is a cloud-native imaging system that's just won the tender for the entire University of California health system running on AWS. This has a massive impact, with hospitals no longer requiring on-premises compute and storage, and data available anywhere at the point of need. In regards to genomics, we're seeing more and more requests for national biobanks and genomics repositories. An example is the UK Biobank, which is the world's largest biomedical repository with 500,000 research participants with fully sequenced genomes. They partnered with DNA Nexus, who built a research analysis platform on AWS, which democratizes access to all of that data. So until now, approved researchers had to download the identified participant data and then conduct research in their own compute environment, which was a very high barrier to entry. It required significant local resources in terms of storage and compute, and also downloads took a long time. So this new research analysis platform replaces these time-intensive downloads and compute times to really allow flexible access to data and the availability of machine learning and computing power in the cloud adjacent to those resources. So applications to access this data now come from around the world. So 90 countries access the UK Biobank data, with 75% of requests coming from outside the UK. And because researchers don't need any on-premises infrastructure, a large number of applications come from low and middle-income countries, which themselves are supported. So just to give you a sense of scale, the UK Biobank currently contains 11 petabytes of data, which is expected to grow to over 40 petabytes of data by 2025. And if you think about what that looks like, if you watch high-definition 4K movies, you'd have to stream those movies for a century to consume 40 petabytes of data, which I think is an incredible visualization of quite the scale that we're talking. The same kind of principle comes from the data commons being developed by the University of Chicago Center for Translational Data Science. And they wanted to create a federated model. So different organizations could set up genomics repositories, but could all work seamlessly together. And they've created a data commons framework called Gen3. And they're able to host multiple federated data sets where the ownership and access rights are maintained by the creators. So they now host more than 10 petabytes of data across 15 data sets. And they run 10,000 bioinformatics workflows a month, with more coming online all the time. And so we've got bioinformatics data sets being spun up in Australia, New Zealand, and South Africa. And of course, to work with our great partners, Illumina, who've released their Illumina Connected Analysis platform, analytics platform on AWS, and Canada's very own DNA Stack, who've all federated platform for sharing viral genomes. Analytics, artificial intelligence, and machine learning have really been at the forefront of a lot of this innovation. During the pandemic, the Hospital das Clínicas Innovation Center in Brazil, in partnership with the private sector and the federal government, created the RADVID-19 project, which used AI as a platform, and any hospital in Brazil could upload their chest CT scans to the platform, and the platform would respond with a segmented analysis of that scan, giving the likelihood of COVID and the location of the COVID in the lungs. And this really democratized the access to expert opinions all around Brazil where there weren't expert doctors to look at the scans. Likewise, Moderna and their drug design studio, which is built on AWS, was the power that powered the identification of the new vaccines that were produced. And so, again, scientists can have an idea for a unique protein, order it online that day, and then start running experiments on it in less than a month. And traditional pharmaceutical research and development, this would have taken years to get to the point where you're ready for even preclinical studies. So 2 days after the COVID genome was mapped and publicly posted, a vaccine candidate was already finalized. Adaptex is a Seattle-based machine learning startup that puts the power of clinical data into the hands of care providers at the point of need. So it allows interrogation of the electronic health record data to answer questions in real time. For instance, a hospital in the Pacific Northwest had a national average time for delivering clot-busting medication to patients who had admitted with strokes. And they were very happy. They had a national average time. They were doing very well. However, the question was whether there was any difference ethnicity made to those results. So normally that would require a data scientist and several months of analysis to download all of the hospital medical records, to filter it by ethnicity, and to look at the outcomes. But using this platform, they were able to make a real-time query of the data, and it showed that Black patients had an on average 30-minute longer time to treatment than non-Black patients. And not only that, the exact stage of the delays could be seen. So time to scan, for example. And it's with these real-time insights that they were able to close that equity gap within 30 days of it being identified. So it wasn't the lack of data that was the problem, it was the lack of actionable insight. And likewise, Trillium Partners have been innovating using data analytics to understand capacity planning and bed occupancy. And so reducing that lead time and guesswork about how many beds are going to be filled down from 2 or 3 days to 1, ensuring optimal use of resources into near real time. As mentioned earlier, health equity is a real focus. And last year we launched the Health Equity Initiative, delivering over $40 million over 3 years to support projects addressing underserved populations. WellTel, I mentioned earlier, and Vodafone's MMR Foundation program is running in the rural parts of Africa, increasing access for pregnant women and young children to access healthcare in a timely fashion. Sustainability is also a key factor that customers are asking of us. And so the definition of sustainability is meeting the needs of the present without compromising the ability of future generations to meet their own needs. And it was indeed the focus of the WHO World Health Day this year, with a focus on our planet and our health. So we know that it's important to business, we know that it's important to consumers. And when it comes to cloud computing, scale and experience make an incredible difference. So in 2019, 451 research showed that AWS infrastructure was 3.6 times more efficient than the medium US data center. And compared to on-premises computing, AWS had an 88% lower carbon footprint. So organizations that are looking to offset their carbon by moving to cloud have a really good way of doing so. And we're also able to tell them exactly how much carbon is being offset by that move. We have an absolute focus on open source and open standards, and we see the desire for governments and research organizations to move to open environments where they're not locked into proprietary licensing as a real key. And we were also very fortunate to be able to support the World Health Organization during the pandemic around the WHO Academy, looking at how we can train the healthcare workforce alongside offering virtual skills workshops and other training, building on the open WHO interactive online training program. We provided analytics support for their daily dashboard about their global COVID numbers, and also supported the Epidemic Intelligence from Open Sources initiative, which aims to develop a unified global early warning system using publicly available data sets. And so at the beginning of December 2019, it was processing the first one, and it spun up to pass more than 120,000 articles a day by mid-March 2020. And we're creating machine learning tools on top of that, not only to look at the data itself, but also to identify and classify rumors and misinformation, countering what was the so-called infodemic. Innovation, education, and startups. I've already talked about the great work that's being done in the University of British Columbia and their KIC, and we have similar work coming from around the world. And so the University of Radboud set up their research environment in a very similar way to the KIC, democratizing access to imaging data to 70,000 researchers that enabled both that access to data and machine learning tools from around the world. Likewise, the KIC inspired University College London, so my alma mater, to develop their Centre for Digital Innovation, powered for AWS. And this all goes to really power this rich startup ecosystem. And so we ran a startup accelerator last year in the US, identifying innovative startups addressing healthcare issues. We ran a further healthcare accelerator in the UK at the beginning of this year. And we've just launched a health equity accelerator, which again, all the information is available online. And we're focused on training and upskilling the workforce. So we committed to training 29 million people around the world to grow their tech skills with free cloud computing training And there are a whole selection of different resources that are available for that e-health workforce of the future, but also decision makers, policy makers that we're engaging with, clinicians, and also the decision makers, the CEOs. Just now, we've released the information that we're training 2,000 engineers in New South Wales to support their digital transformation of their healthcare ecosystem across Eastern Australia. And finally, around seamless care delivery. So again, during the pandemic, this delivery of virtual care has been top of mind. We saw the likes of Lumica, who I mentioned earlier on, delivering virtual care across Canada. And I just wanted to call out East San Giovanni, which is an example from India. So they were able to stand up in 19 days a virtual care platform across 4 states that was free to patients and available 12 hours a day, 7 days a week. That was scaled up during the pandemic to allow 1 billion people to seek virtual care. That's over 80% of the population of India. And they spent up to 6,000 consultations a day across 23 states, with running 150 concurrent outpatient clinics. Now, they're scaling up to 300,000 consultations a day on the platform, which I think is absolutely incredible. Real-time monitoring has been a feature, not only during the pandemic, but also before, with the likes of Humor. Again, they were able to put monitoring devices in people's homes. And there's a great paper that was published in April from eClinical Medicine that showed that those people who had respiratory symptoms with COVID and were on the borderline of discharge from hospital, normally they'd be kept in hospital, but they could be sent home with active monitoring. With active monitoring and early escalation of disease worsening, 94% of those patients who are fit for discharge with home monitoring could be monitored safely at home, with only 6% being escalated and readmitted. And of those 6%, no excess mortality and morbidity were identified. And this is clearly a great relief to the burden of the hospital system. And also Propeller Health, that gives insights into patients with asthma and chronic respiratory disease about their use of the drug and alerting physicians and their care providers when early intervention might be required. And we're launching as part of our platform things like IoT Twin Maker, which is a service that can be built into applications created by tech companies that really enable them to go faster to develop digital twins. And finally, I just want to talk about Vectorious, which is the first cardiac implantable microcomputer. And so this is where the power of the Internet of Medical Things comes into its own, where this device can measure real-time heart pressure within the atria that gives really early warning signals of patients who might deteriorate. Vectorious is a group that's being spun up out of Israel, and I think we're going to be seeing more and more of these implantable real-time measurement devices. So, I hope that was interesting. I hope that was a quick move through all of those different areas that we see our international customers asking for. A focus on mission workloads, a focus on population health, government scale initiatives, a focus on education, educating the workforce, startups and innovation, and also this move to virtual care. And I think you've seen from the examples provided already that you in Canada have done, you fit what's been going on around the world very well. I think we see a lot of synergy about what's taking place. And also, I hope you can see that what you're doing is actually leading the way internationally with the likes of the UBC kick. I hope that I've shown you that cloud really enables this security, scalability, value, and democratization, not only of access to data and computing to build solutions, but also delivery of those solutions to the end users. Industry challenges are already being met by the cloud. So I'll put it back to you again. What problems do you see in your daily practice that you think you can leverage using some of the tools that I've demonstrated today? Now, if you do have questions, of course, we have an absolutely fantastic team on hand to answer them, led by Larry Sylvester, who's the Canadian healthcare lead for AWS. And I know the rest of the amazing Canadian AWS team will be very keen to discuss these with you at length. And genuinely, the possibilities are endless. So finally, I just wanted to share some other exciting events that are coming up in June across Canada, and you'll be able to access these later, but it'd be great to see you in person at some of these events. And as I said, we'll be having some of the case studies that I mentioned here, those people that were delivering them live on stage. I'd just like to thank you all for your attention. And if you have any questions, I'll be very happy to answer them in the chat later on, or we'll be able to answer them throughout the day. And thank you very much again for your attention. I think we're living through a period of great disruption, but with that disruption comes incredible promise. Thank you.
Thanks, Rowland. I have been looking at the chat that's been forwarded to us, and we do have a lot of questions that have been answered, thankfully, in the chat as we've been moving along. So I don't see any current questions. I encourage people to put them in there, or Ashley to share them with me if you can see them. But I guess, Rowland, one of the questions that a lot of our public sector customers have is, where do I start? So if you had, a little bit of advice to give our public sector customers, what would you say in terms of where they should start their healthcare journey in the cloud?
I think the critical starting point is having a specific question to answer. I think if you can identify that first thing that you would like to do, and then reach out, we have loads of support and resources available to help you answer it, both in terms of professional services, great partners who may have done this before. So again, the chances are that this question may have been asked somewhere else, and we can bring some of that learning to you to help answer it. Having that first question is the key. And then really the second part is about education. So how do you make sure that you can be as self-servicing as possible to those needs? And again, we're very happy to talk to you about education and how we can really start you on board on that journey.
Great, thanks, Rowland. And I think another question that we've seen has been, where are we going with regard to open records and open patient records and access directly by patients to their own data? How do you feel, and what do you want to talk about in terms of that topic, and how AWS is leading?
Now, I'm aware that we're at time. This is a fantastically interesting topic, and I could easily talk for another hour just about consent-mediated data interoperability, because that is what we're talking about. It's about putting the power of people's medical records into their own hands and allowing consent-mediated sharing at the point of need. I think this is something we're going to see come to the fore in the next 5 years, and it's going to be driven by patients, and just patients demanding, citizens, saying, it's my data. If I wish to share it with a care provider at the point of need, why shouldn't I be able to do that wherever that data resides, whichever silo it's in? And I think some of the work that's being done around the federated data in genomics, which I mentioned earlier on, has direct applicability to federating your own data, the individual's data from those different silos. Because I want to be able to share my data with you if I see you in clinic, but likewise, if I have a rare disease, I may want to share my data globally, saying, am I available for a clinical trial? How do I do that? Currently, I don't. I rely on my oncologist to put me in touch with a clinical trial that they may or may not be aware of. I think the power of democratizing access to the individual's data will be absolutely critical.
Fantastic. Well, I think that's all we have time for today. Thank you, Rowland, and enjoy the conference, everyone. Have fun.
That was certainly an inspiring presentation. I'd like to thank Dr. Illing for his important global perspectives on innovation in healthcare using the cloud, and for sharing how it can be leveraged to solve some real problems in healthcare, including some of those very relevant Canadian examples that were orchestrated through the pandemic. He also made a quick remark in his opening notes about support for our Canadian hockey team, and I think that we will also take that. So next up, I would like to invite everyone to join us in the virtual trade show. You can access the trade show from the top of your screen. Just click on the booth icon. We have 15 exhibitors who are ready to meet and chat with you, and you'll find great information there. And don't forget that you also can collect points by checking into the booths and win some great prizes. So following the trade show, we'll head straight into our first 4 concurrent sessions at 12 noon Eastern time. So I'll see you at the trade show.